Welcome back to my channel. Watch and learn with Umaima. Know about test tube baby and test tube baby process, IVF. Some couples are unable to conceive a child because of infertility issues or a blocked fallopian tube in the case of women. As medical science kept on advancing, new methods were discovered to develop an egg artificially in a glass container called IVF. In vitro fertilization, IVF, is one of several techniques available to help people with fertility problems have a baby. The first successful IVF was done in 1934 and the world's first IVF human baby was born in 1978. IVF treatment is also chosen to avoid the passing of genetic defects. What is a test tube baby? A test tube baby is a baby who is conceived by IVF. IVF is in vitro fertilization where the word vitro means glass. In such cases, the fertilization is done outside the uterus in a glass vessel by combining a female egg with a sperm. IVF and test tube babies are the same with no difference at all. It is just that doctors specifically use the term IVF instead of test tube babies. Test tube baby process or IVF technique. Conceiving a baby through a test takes quite some time. First, the doctor checks for the ovarian reserve and does all other checks. A USG is done to check the condition of the ovaries and the other reproductive organs. After discussing all the legal and emotional issues, the process starts. This is a 5-step procedure. 1. Stimulation. As IVF requires multiple eggs, therefore fertility drugs are given to the woman in the first step. The patient will be under the doctor's observation with regular blood tests and USGS. 2. Egg retrieval. This is a surgical procedure where a needle will be inserted through a woman's vagina to the ovaries and an egg containing the follicle shall be removed by suction. 3. Insemination. In this procedure, the sperm from the semen sample is mixed with the egg in a petri dish. The sperms fertilize the eggs overnight. 4. Culture of the embryo. This glass dish shall be kept under a doctor's supervision in a laboratory and will be monitored constantly to check whether the egg is dividing or developing. 5. Transfer. 3 to 5 days after fertilization, the embryo has become big enough, it is implanted into a woman's uterus with the help of a catheter. The later process of pregnancy takes place in the embryo and it takes 6 to 10 days. Let's see complications associated with IVF. Doctors consider the IVF treatment quite safe and there are high chances of egg fertilization. However, it can come with some complications. 1. Miscarriage. To know more about miscarriage you can watch this video. 2. Multiple pregnancies. 3. Ectopic pregnancy where the egg is implanted outside the uterus. 4. Some patients can develop ovarian hyperstimulation syndrome, OHSS, where excess fluid is filled in the abdomen and chest. 5. Bleeding. Let's see test tube baby cost. The cost of IVF varies in different clinics and depends upon multiple factors. If you wish to get an IVF treatment, choose a hospital or clinic at first. Talk to them and understand the overall cost and all the things it includes and excludes. In India, the cost of a test tube baby can range from 70,000 rupees to 1 lakh rupees and 30,000 depending on the condition. Thank you for watching. Don't forget to subscribe.